cancer is a major national health concern in Jamaica and a leading cause of death on the island. In 2022, some 7,500 cases were recorded here in Jamaica, with more than 50% of those resulting in death. Hi, I'm Kediesha Watkis, and this is the Wellness Beat. My guest today is a beauty queen and an advocate. Her name is Kaydia McKoy, and she is Mrs. Cosmos Jamaica. She is also a breast health advocate and affiliated with the Jamaica Reach to Recovery. She is a breast cancer survivor. Hi, Kaydia, welcome.
Hi, thanks for having me.
So how do we link the two, beauty queen and advocate?
Boy, that's the advocacy is what led me to being the queen.
Right, because you moved
Right.
from being a healthy 30-year-old
Right.
to a breast cancer survivor. Walk us through that life-changing experience.
Lord, it was 2020 when I felt the lump in March. And I watched it, I said, let me wait and see what this is. And I waited until after my 31st birthday, which would have been May 3rd.
Okay.
And I said to myself, this lump wasn't going anywhere. It was literally getting bigger. So I said, let me go to the doctor and see what's going on. So I made the appointment, but for me, it was like, if something comes up, then I'm not going. But if something comes up, then, then, it is what it is. But nothing came up, and I went to the doctor, and she said that, it was nothing, she felt the lump, but she said that I was too young for breast cancer. Wow. She asked me if I have a history of cancer in my family, and I said to her, yes, there is a strong history of cancer in my family, but not breast cancer. And I advocated for myself. I said to her, I want to go and do a mammogram. And she said, all right, I'll let you do a mammogram and ultrasound. Immediately, that was a Wednesday. By the Friday, I did the mammogram and the ultrasound, and the radiologist was able to tell me that it was indeed breast cancer. She said, this is not something that we're going to aspirate. It is breast cancer. For me, I froze because I wasn't aware of breast cancer.
At 30 years old?
Yes, I'm like, at the time I wasn't thinking that, hearing cancer, then you said, all right, I'm going to die. But I wasn't thinking about that because I wasn't aware. So I did not know what to expect. I know people die from cancer, but I'm like, maybe I was in shock. I don't know. But I went on to they said that I needed to do a biopsy. Mm-hmm. I did a surgical biopsy. After the biopsy, I waited about 6 weeks, got the results. It was confirmed that it was stage 2 estrogen positive breast cancer. I then went on. By this time, it was like a whirlwind. And my daughter, who was 4 at the time, and I said to her, Mommy's sick. And she said, what happened, Mommy? And I said, Mommy's sick with cancer. No, she knows that my dad passed from cancer. So when she heard cancer, she was, Mommy, are you going to die? And I said to her, Mommy will not die. Mommy will be okay. I had to reassure her. Yes. Then she got the little song and she started playing my fight song. And she said, Mommy, this is our song. And she was only 4 at the time. And I'm like, man, I cried. And I said, I have to fight for her. I really have to fight for my daughter. I mean, my husband is there. I love my husband, but she was only 4 at the time, right?
And so you fought through,
so
right?
I did. I went on to surgeries. I did a hysterectomy because I had an ovarian cyst as well, and they thought that there was a link between both areas. So I did a hysterectomy, bilateral oophorectomy, nipple-sparing mastectomy, and reconstructive surgeries. After that, I waited again for another 4 weeks to see if the cancer had spread to the lymph nodes, and the results came back. I had spread to the lymph nodes. I did chemotherapy. I did 6 months of chemotherapy, and I did double protocat surgeries after that, during that period of chemo, and then I did 5 weeks of radiation.
So it's a lot that has happened.
Happened within 1 year, yeah. It was, and no, my business, I just started my business and it was going so well. So imagine cancer and the COVID, you know, it's like having a handle at life and that handle just broke like that. And I feel like I haven't been able to pick up the pieces since then. I am still struggling to figure out, to see, you know, to understand the new me with all that I've been through and still going through with the treatments, because I'm still on medication for another 10 years. I'm still doing bone treatments and I'm still finding myself. And
after all of
that, I'm like, sometimes I cry and I said, I can't do this, but people just see you every day and they see you wearing a crown, they see you wearing a sash, and they just think that, and they see on social media smiling and taking pretty pictures, but they don't know what is going on.
What has been going on behind the scenes.
It's still a lot.
So behind the scenes, you have been doing multiple surgeries. You have been taking medication and really just fighting through this. But I want to backtrack something you said about discovering the lump. What were you doing to have found that lump?
So funny, as I say, at the time I was 30 and I wasn't aware of breast cancer. I don't know where this came from, but it was just my instincts. I was just taking a bath and I started checking, and I was doing this like maybe for a couple of months, just checking out.
So you were just you would have been doing a self breast exam.
Each time I take a bath, I'm rubbing and I felt this little thing like a marble. It was round and small and hard. And that's when I discovered the lump. And I said it to my husband and he felt it too. But we waited, you know. I mean, it was stage 2, but 14 out of 17 positive notes. You know, I'm so grateful to be here.
And so, in all of this experience, you would have also been ramping up your awareness, because you would have moved from not knowing so much about cancer to discovering a lump, and then a whirlwind, a flurry of activities taking you through this diagnosis. Just give me a glimpse into how that unfolded for you in terms of becoming more aware.
Listen, I went to writing my book, and you know, and for me, even though the books are out, it's not even so much about the money collecting from the books. It's more of awareness, you know, for a woman. I am out there because I know what it feels like, you know, being diagnosed, not having information, right? Because information, it's crucial with the fight, and support is a big deal as well. So I think since diagnosis, I spend most of my time, you know, just out there reaching out to a lot of women, especially younger women.
Right.
And I said to them, when I go to the universities and I do all these sessions, I said, please listen, because I was diagnosed at 30. I wouldn't imagine that I would be diagnosed at 30.
And no, as a 30-year-old, that would have been in 2020.
Right.
Right. And so this has now become a part of your life, the routine screening, you are still on medication. Right. This is now a very, very important part of your life. How has it impacted you?
Well, you know, I actually feel much better now than before. I feel, you know, I'm keeping abreast with my health. I go out, I'm not afraid to do my mammogram, my ultrasound, you know, whatever it is. I am more aware if something is happening. There is no waiting time for me, right?
You're nipping it in the bud at the same time.
Yeah, immediately. So I'm very much aware, and I know my body now. And they said that you are what you eat, so eat well. So I'm eating well now. My diet is like maybe 99% better than it was before.
So there are changes in terms of having an active lifestyle, and changes in what you eat, so that you can be overall much better in terms of your health. I know that when we were talking backstage, we mentioned the mountain of support that you had at this pivotal time in your life.
Right.
I also want to hear about the financial support. You talked a little bit about getting some important government-funded support.
Right. So I had a mountain of support, with each bringing different gifts of strength, whether it be financial or just to call and say hi, or just to, accompany me to the doctor, to my appointments. And that is why I know how important support is with the fight. And so the Jamaica Reach to Recovery, I got funding from them as well for chemotherapy, and and just support overall, because there are several ladies there, like 100 and something. And can you believe it, like 150 ladies who are survivors or fighters. So we share stories because we understand each other, right, and what we're going through. And I am a Chase Fund, beneficiary. I benefited from Chase. I also benefited from, I'm still benefiting from NHF. I'm so thankful for National Health Fund. All those chemotherapy drugs that are, in the thousands, I, pay not so much for them. And even my medication now that I am on for another 10 years, that is like maybe 40-something thousand, and I pay 2,500 or 500, right? How can I not give thanks? So I'm so grateful for NHF and all the government entities that I get assistance from, and, just saying thanks on the behalf of all the other women who are benefiting from all these agencies.
Right, and so now you are proudly wearing the sash of Miss Cosmos Jamaica. You're proudly wearing this beautiful crown as well, as a part of your own advocacy. Right. I want you to tell me, as we're wrapping up, what would be that one message that you would leave with our audience, especially women who are just like you? They're going about their daily business, they're running their business, they have their families, and they're not expecting something like this. What would you say to them?
Listen, take the time out to self-check, do your mammograms, because early detection saves lives. It does. And if there is something, don't be afraid, because there are several treatment options out there, right? And you can survive this no matter what, it's not going to last forever. I tell myself, when I was on the journey, I said that I'm in an aircraft and it's very bumpy, it's quite turbulent, but I'm going to land soon. I am on this rough path, but I'm going to land soon. And that's what I kept on telling myself. It will not last forever. And I am a living testimony. I'm here, I did my surgeries. I remember counting down the chemotherapy. And there were days when I go for my chemo and I wanted to pull the strings off, just pull everything and just walk out, because that's how it makes you feel. But guess what? I am here, my lashes are back, my hair is back, my nails are not discolored anymore. And I'm here with my daughter. She's 9, and I'm seeing her just flourishing in school and doing well. And thank you, God, that I did not give up. I press on, I pushed through, and with faith, I prayed and I cried and I said, God, thank you, I did not give up. Because there were days when I was on the bed and I was just waiting to die. I was like, God, I can't do this, just take me. And I prayed and I cried and I said, God, you have to pull me through this. And I pulled through. So just have faith, never give up, and find support. There are lots of support groups out there.
Yeah. Wow. Kaydia, you have me almost tearing up here on the set, but we've talked about so much. We've talked about the process that you've gone through, this life-changing transformation, how you grew in your own awareness, and how you've grown also to become an advocate in this important this journey, because we have an increasing non-communicable diseases problem here in Jamaica, with cancer being one of those major diseases that we are suffering from. So I want to thank you so much for joining us. Before we close, I just want you to let us know, where can we find you? You have an advocacy Heads Up for Pink. Just let us know where we can connect with you.
Sure. So I am on Instagram at Kaydia_McKoy, and I do share videos, you know, little video snippets here and there of, you know, just health benefits, what to eat, and diagnosis, you know, just information. I'm also on TikTok as well. I'm on TikTok, but with information, nothing else.
Okay.
And my YouTube channel is Kaydia Levine. And also as well, I do sessions with breast cancer survivors and fighters. So, you know, hearing different stories will definitely, you know, educate you on what to do if there is a lump or,
yes,
you know, different treatment side effects. So it's quite informative. I have an informative platform.
Right, and so we will hear much more about your story, even through those channels. I want to thank you today, Kaydia, for joining me. My guest here is a breast cancer survivor. Her name is Kaydia McKoy. She's also affiliated with the Jamaica Reach to Recovery, Mrs. Cosmos Jamaica, sharing her breast cancer survival story. On the other side of the break, we talk with Dr. Tamu Davidson. She is the Director for Non-Communicable Diseases and Injury Prevention inside the Ministry of Health and Wellness, and we'll hear so much more about cancer screening, detection, and prevention. You're watching The Wellness Beat. Thanks for staying with us here on The Wellness Beat. We're back with Dr. Tamu Davidson. She is Director of Non-Communicable Diseases and Injury Prevention inside of the Ministry of Health and Wellness. We're going to be talking with Dr. Davidson about the resources for cancer screening available inside of the public health system. Earlier, we talked with Kaydia McKoy, who shared her story of being diagnosed with breast cancer at age 30. Welcome to the show, Dr. Davidson.
Thank you. It's certainly a pleasure to be here to talk about such an important topic that affects every single Jamaican.
Right, and the figures, Doc, are startling, both in terms of cancer cases and deaths. But what I think may be shocking for those who are listening or looking on, nearly half of cancer deaths are preventable?
Yes, so based on what we know now, and about cancer and what can be done, we know that there are lifestyle related things like your diet, your nutrition, which is a great contributor, obesity. We know things like also exposure to certain environmental factors can increase your risk for cancer. But most importantly is that many of the common cancers, and for Jamaica, the most common cancers amongst women, it's breast, followed by corpus uteri, that's uterus, and cervical cancer, and colorectal cancer are some of the common cancers.
Okay.
When we look at men, the common cancers are prostate, colorectal cancer, and lung cancer are some common cancers. And so we know that these cancers can be, we can screen for these cancers or implement early diagnostic testing in order to prevent persons from dying from these cancers. And our data shows that cancer is increasing, and the concern is that we're seeing more and more younger persons die.
Yes.
So dying prematurely within the age group 30 to 70 years old, meaning that this is your most productive aspect of your society. And we know that cancer doesn't just affect the individual,
yes.
It is the family, the society, and very often many of these persons are the breadwinners or central to the family themselves. So a diagnosis of cancer brings in everyone and the entire family.
Right, touching across all points of society,
Yes.
the family unit or productivity or economy and so on.
But I want to say that you can get cancer at any age. And one of the things we know, as we also looked at childhood cancer
Yes.
in February, was that 80% of childhood cancers can be survived. And we know that the majority of these cancers that are being survived, children are surviving from these cancers once you make the diagnosis. So prevention, not heavily emphasis in that group, but making that early diagnosis and getting the proper treatment, that you can have a 80% survival rate.
Right. And with that early diagnosis, the routine screening tests are available. Can you walk us through some of those that are available in the public health system?
Yes, so for the common cancers that we've been really working on addressing breast cancer, so mammography is recommended as a screening method, primary screening method. We also do clinical breast examinations as well for women. And for men, we do the PSA, that's the prostate specific antigen, which is a blood test. And we also do what we call the digital rectal exam, and that's when we examine the male through their rectum. So, you know, not a popular
not very
approach,
popular with the men.
You do need to do both,
but important
as a part of your preliminary screening. And for colorectal cancer, we do what we call a stool test as well, and then refer if they need to do colonoscopy. So those are our three major common cancers. And then for cervical cancer, currently we're offering the pap smear. And so these cancers, we know for sure that cervical cancer can be eliminated. Colorectal cancer, you can detect it early before you actually even have cancer. And certainly for breast cancer, we can detect it before you actually have symptoms. And so that's where we want to do what we want to do. And so also for prostate cancer. So one of the first steps that we recommend for patients, because now we're taking a holistic approach, we take what we call a life course approach. So we look at your age and at what stage and what are some of your risks and what are some of the tests you need to do. We do the same thing as it relates to cancer as well.
Right, for both men and women.
For both men and women. And most importantly is that you have routine checks, health checks. And in that conversation with your doctor, you should be asking, you know, what is my risk?
Right.
And you look at the risk. So you have to look at other things like their family history, genetics, to see whether, okay, are you high risk? So if you're high risk, the screening conversation is different. The test that you'll need to do and when you need to start will be different.
It's a matter of when, not if.
Yes, your routine test. No, if you're at average risk, your screening conversation is going to be different. So you may be doing the routine age group. So, you know, for men, recommend screening for prostate cancer at age 40.
Right.
So you really need to have that conversation to assess your risk to see if there's any additional risk that would put you in a high risk group in order for you to get screened.
Right.
But we know many of our cancers that people have, they have none of the common risk factors that we are aware of that actually get cancer. And of course, lung cancer, which is common in men, we know primarily one of the major contributors is smoking. And so, of course, you know, we have our smoke-free laws in place, or tobacco legislation that helps to protect people from the effects of secondhand smoke. But also, if persons want to quit, we also have our National Council on Drug Abuse, who you can contact to help
get
you
that
through
kind
that
of
process. Support, and also at our health centers as well.
So several cancers that are very, what we'd say, I don't want to use popular, but we're seeing high incident rates here in Jamaica. You've mentioned breast cancer, colon cancer, and others. But along with that, a slew of resources are available inside of the public health sector. I wonder, Dr. Davidson, what is the uptake like? Because we have this important message that early detection is key. Early detection saves lives. what has the take-up been like, even especially with some of the programs of the ministry, Know Your Numbers and so on? What are you seeing in the population in terms of the take-up?
Yes, so for screening for cancer, it has not been adequate. The highest level we have had in terms of screening coverage is for cervical cancer. And with that, we have actually seen a decline in deaths related to cervical cancer.
Okay.
While cervical cancer is the second leading in terms of cancer death, it's not in the top three. It's third for women, in terms of cancer incidence. So it has been surpassed by uterus cancer. So even though we have seen a decline and a steady decline in deaths and also incidence, because coverage rates can go as high as 60% for a little over 60% for persons within the reproductive age group or target group. And we know that just screening even once in your lifetime can really significantly reduce your risk. It is still inadequate because we know that this is a cancer we can eliminate. And what does that mean? We get it down to what we call an incidence rate. So of 4 per 100,000 women. So every 4, you only have cervical cancer occurring in less than 4 in every 100,000 women that are alive. So we know we can do that through vaccination. So vaccination for HPV in our school children is critical and is essential in us now talking about cervical cancer as something in the past, like we have done for malaria and like recently we have done for the mother-to-child transmission of both HIV, syphilis and HIV. So we can get there with the vaccination. So we're saying at least we want to have a 90% coverage in vaccination, a 70% coverage, screening coverage, right? And also we want to at least have 90% of those who we identify. And with cervical cancer, you can actually detect the precancerous lesions, changes that take place before you actually get cancer. Right. And you can actually treat that. So persons don't have to die from cervical cancer.
Yes, so the resources are there, the tools are there. We have the screening tests, we have vaccines, and we need more Jamaicans to come in.
Yes. Certainly for breast cancer, we have seen over a 10-year period a 68% increase in death due to breast cancer. And we know if you come in early, get detected early, and our screening rates are very low. They're less than 20% for mammography. That's very low. And we know with screening rates are low for our men as well. And this is based on studies that we have done through our health and lifestyle survey. Right. So with all this effort we've been doing in educating persons, working along with our partners, because we cannot do this alone. It has to be through every single Jamaican that's out there to share the message, to arrange the workplaces, to arrange screening events, to facilitate their employees accessing these routine tests. Yes. Because basically this investment is an investment in the workforce of Jamaica and our future. Right. Because losing a mother, losing a father, that leaves our children vulnerable to other health issues and problems. Right. And so we want to ensure that we have a productive Jamaica and healthy Jamaica.
And that certainly is the message. Healthy lives, healthy people. We want all Jamaicans to be healthy. I want to just touch, as we're wrapping up, Doc, what the ministry has been doing in terms of taking this accessible and affordable screening service to the population.
Yes, so we have developed a standard for screening all over Jamaica as to what you should do for screening. We've been doing training and capacity building. We have been also encouraging persons to come to our health facility or to go to their private doctors as well. So we've collaborated with other stakeholders to promote screening in their setting. Through collaboration with the Cancer Society, every month, whatever cancer month, that is the focus, they have also been promoting screening and sharing that information. There are many cancer survivor groups. We've been working as well with putting out educational messaging and supporting that process, because we want to make sure that we, not only in our health facility we're offering the services, but also in the private setting that person can access that service. So one critical thing is that the National Health Fund covers drugs for common cancers, and they've added to that whole suite recently. And in addition to that, they're now covering the cost for pap smears, they're covering the cost to get screening for prostate cancer, which these are the two common cancers, right? Cervical cancer, prostate cancer. They're now covering that cost in the, not only for the public setting, but also in the private setting. So your general practitioner, whoever your private doctor is, once you have an NHF card, so you just need to register for that. They're registered with NHF. You can go there and you can get a discount on those tests.
And it's so interesting that you brought that forward, because our guest, Kaydia, she talked about the tremendous support that she has received through the National Health Fund, having been able to still accessing her medication through the National Health Fund. So I am delighted to hear of the slew of activities from the Ministry of Health and Wellness, the funding support that is there, the information, the material, the standards for screening. And it's just a key message that we're leaving with the population, that prevention is possible even with early detection. So as we're wrapping up, Dr. Davidson, just a one-liner from you to our audience in terms of accessing our screening services in the public health system.
So the opportunity is there with you. Treat yourself, either do your next birthday present, your next Christmas present, saving bit by bit. We cover the costs in the public sector for those that you may have to invest in and pay as well for some of those tests. We say treat yourself to this. This is not just for you, for your family. Treat yourself to getting your screening test. And I would say know your status, know your numbers. We say that. We can't overemphasize that. But not just knowing it, but also doing something about it. So, visit your doctor. I think the first step you can do is visit your doctor and ask, what is my risk? What are the tests I need to do? Come to us in a public setting. If you choose to go in a private setting, just ask that question of your doctor. And look at some of your risk and some of the tests that you need to do, including for those specifically looking at cancer screening.
And that is an excellent note on which to wrap up our interview. Dr. Davidson, I'm so thankful for the opportunity to talk with you about this very important, this major national health issue, the matter of our rising cancer cases and the fact that we do have resources that are available. So that is all the time that we have for this episode of The Wellness Beat, and we've been covering cancer screening, prevention and detection. It's been a pleasure to have you here with us. We hope that you'll stay tuned for the next episode. Thanks for watching.